All right, are we ready?
Yes.
Maya? Okay.
I'm here.
In 5, 4, 3, 2.
Look at you. You made it to another episode of We Did That Shit podcast, where we talk about who did some shit, how we got through some shit, and what we learned from shit.
I'm Maya.
And I'm BIbbi. Podcast family, we appreciate your support. If this is your first time tuning in, welcome. If you like what you hear, please subscribe to us on your favorite podcast platform and tell us what you think. We're on Facebook, Instagram, and Twitter at We Did That Shit.
Hey.
What's up, Maya? Hey. What's up? I ain't talked to you all week.
I've been busy.
Clearly. Clearly.
Busy doing nothing. No, I've been busy for real though.
Clearly.
Way more busier than I wanted to be.
Me too. When I go to work and have to do work, I'm like, whoa.
Mm-hmm.
You know, when I go to work and have to do work, I feel like I need my paycheck that day.
Mm-hmm.
Like, all right, I'm finished
with a bonus.
Now. Thank you. Yes. Like, can you get my check now, please? And right. I want one on payday. Like, this is crazy.
Mm.
So what's going on?
Nothing much. I mean, how was your week?
So last week I told you that I'm God's favorite, and then I just have to play along because all kinds of stuff was happening.
Mm-hmm.
And stuff just kept happening. You know, refrigerator broke. Now my dryer is broke. The air conditioner in my car broke. The girl was calling, talk about she wants an apartment with a view. It's just too much. But, you know, I told the Lord, I was like, that's fine. I'll play along. You know, so things are looking up. The refrigerator is not broken.
Good.
Somebody turned the dial down or something. And the dryer, I'll probably fix myself. I got my air conditioner in my car fixed today.
Well, thank God, because you don't want to be a killer on the road.
Let me tell you something. I'm a humble person. You know what I mean? I know I'm God's favorite and everything, and I'm a humble person. But I don't care if you going, what did he say? When I took it today, the guy said, oh, what you been using, 450 air? And I was like, 450 air? What's that? He said 4 windows down, going 50 miles an hour.
About to kill somebody on the road. You ever notice that the people with no air conditioner in their car, or they got their windows rolled down on the hottest day, they go so fast, even on the side streets, they be ready to cut you off. And I used to always say, why the hell they going so fast? But then I realized when I pulled up next to them in the light with my air conditioner blasting, like, oh, you don't got no air. Okay, I get it. You try to get that quick breeze.
First of all, before my air broke, I used to think it was nothing wrong with a little bit of fresh air. You know what I mean?
You think different now.
I was like, oh, maybe people got their windows rolled down because they just want some fresh air. But when the heat is on, because when the heat is on Lucifer's cousin,
right?
It's like, oh my gosh. And I would just be in the car riding home just looking like
forehead glistening. You mad as hell.
Sweat drips coming down out my sunglasses. It was hot.
You can't put no sunglasses on when it's hot either. And you ever notice that if you go into the store, like, pay attention, pull up into a parking lot when a person don't have when they got their windows rolled down on a hot day, and then go into like the 7-Eleven after them, they angry as hell. Like, let them go before you. Just let them go before you in line. They be mad as hell. You liable to get murdered that day because they so hot.
Oh my goodness. Well, you know, I just am very grateful for my coworker because she put me with a really good mechanic, trustworthy, honest, you know, and he hooked me up. I mean, it only took him like a couple hours too.
Thank goodness.
So, you ain't lying. He was like, come on now, you all cool. You ain't got to be on the 450 no more. Oh, my goodness. So, that was cool. Got a lot going on at work. Guess what, Maya? I know you're going to find this hard to believe. Are you sitting down? I don't like somebody. Like for real, I actually dislike somebody.
Who?
That's what I said. Like, I don't dislike anybody.
They must be
I had to pray.
The bottom of the barrel.
I said, yeah, because I really am not I don't dislike people. And for me, and then I was having a conversation with somebody and I was like, I don't like her. And as it was coming out of my mouth, I was like, ooh, first of all, even if, I don't have to like you or be a fan or whatever, but I felt like, who the hell are you that you have that much? Mm-hmm. That I think of you that much to even not like you anyway. So I had to get my little stuff together. Like, yeah, that's not nice.
Well, 9 times out of 10, I say 9.9 times out of 10, when you don't like somebody, it's within good reason. And then reason might not make sense to other people, but it makes sense to you. And that's where I'm at with it.
It makes perfect sense to me. And, I don't care. You know what I mean? I don't care. So, but I just thought that was really something because, that's usually not my thing at all. Like, but yeah.
Yeah, it was okay. A little busy, but so, it was the holiday weekend that just passed. I'm thinking like, all right, I'm not coming to New Jersey. I'm going to sleep the whole weekend. Not really sleep because, like I have insomnia real bad, but just lay around in the bed, catch up on my shows that I've been missing. It didn't happen because I had stuff to do that I forgot all about. So my godson came down here and he had a football game, went to that. That, yeah. So they played it, right? So they played in Maryland, and so I went to the game. That my godchild plays for Camden High. So they made us okay. All right. Okay. Calm it down. So they made me a shirt. My god sister made me a shirt. She always got some uniform going on. Like everybody wear uniform. And I told my baby at the end of that game, I said, "You the only person that can get me in some damn purple and gold." And his girlfriend was like, "You ain't going to Camden High, Miss Maya?" I said, I went to Wilson.
She went to the raggedy school.
No, I went to the best school. But we ain't going to get onto that on this podcast. Just know that my baby is the only person that could get me in purple and gold. It was too much. I didn't even post it on Facebook because I was like, this purple and gold and me don't match. I'm orange and black all the way. But did that. Then my goddaughter had a housewarming. She got her first apartment and she had her housewarming in Baltimore.
Does she have a view?
She has a view of nothing. I don't know what she has a view of. Like a courtyard or something. I don't know. She ain't really worried about the view. She worried about when them first bills come. Now, this is the funny thing. When you get your first little apartment, right? I walked in there. I said, damn, it's hot as hell in here. Y'all cooking. It's only a 1 bedroom. It's but it's spacious, but it ain't like a big old, place. So I'm like, damn, it's hot as hell in here. I said, this is when you know that you would grown. When you guys start paying your own bills, you didn't cut the air off. Right. You're like, ninjas ain't soaking up my air. So did that. Exactly. But then Sunday, I just did nothing. And it was like the greatest thing. I really did nothing. I just laid down all day. I got up, I cooked for me. Then I laid back down. It was just wonderful.
And then, doing nothing is the best.
Yeah, and then, that doesn't happen for me a lot because I always got something to do. But So then I went to go see my doctor because I had a doctor's appointment about something else. And then I was talking to my doctor about the podcast, surprisingly. Because me and her is cool. I was talking to her all about the podcast, right. And she was like, well, what is it about? And I was telling her, and I was like, when we do this personal journals at the end, you know, she was like, oh, that's nice. I said, yeah, it's like a diary, you know, of sorts, but we just talking about it with other people, you know. And I was telling her about my personal journals are always about stress, you know, right. Like a lot of them are about stress. So then I started talking to her about how to handle stress and some tools that I could do when I feel stress coming on. And she gave me some real good pointers. But then, you know me, I went home and I started looking on the internet. Googling. And that's like my worst thing. Looking on the internet is the devil, you know.
It is. It is.
It really is. Because it has me thinking that I have all kinds of things. But I came across an article, a real interesting article in the Philadelphia Tribune. And it was talking about mental illness in the Black community.
Oh, wow.
And that really got me to thinking, like, about my mental health, what mental health is. And so I thought that for this show, we could talk about that. We could talk about mental health.
I think that that's some shit that's been on my mind as well. Because a lot of people, first of all, there's been a lot of articles out. I saw one, it was a few months ago. And since then, I've seen at least 4 more. And the headlines read something like, by 2020, depression will be the leading mental health disability. By 2020, that more and more people are not able to work because of depression.
Right.
And we talk about mental health, but in our community, because you know that's what we care about, communities of color, you know, we talk about or don't talk about mental health, but we separate everything. You know, depression is depression, and we don't have time for depression. Because I used to say depression is a disease of privilege. Like I don't have time to be depressed. That's for people,
right?
You know what I mean? Like they can go to the hot springs and be like, "Woo, side, take a yoga class and everything," and then they be like, "Okay, I feel better." You know, so depression is depression. Mental health is mental health. Mental illness is mental illness. And then it's just plain crazy. You know, like we just lump things together and then we judge
based off
everybody for based on what we believe things are.
Right.
So, and now, and I say this all the time that there are there tragedies in the world? Yes. But there are no new tragedies.
Right.
So people have lost their ability to cope. And hence we have these mental health issues. Because people can't cope with regular life tragedies. People die every day. People, you know, acquire diseases every day. Some people do experience violence. You know, but if you're being a witness to violence and being a victim of violence is 2 different things. But now we have more witnesses with mental illness than we do victims, or just as many. So, yeah, so that's some shit that's on my mind as well.
Yeah, so let's get into it. I mean, let's talk about first what mental illness is.
Well, you know, for me, you know, I just do not like the term mental health, mental illness, you know, because I just think it's wrong. People, mental illness has a pathophysiology, which means that it's physical. It is, your brain and your body are inseparable.
Right.
You know, your brain controls all voluntary and involuntary functions of your body. You know, you don't have to say heartbeat, 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 heartbeat. It's involuntary, but your brain tells it what to do. You know, you can control if you want to do bicep curls and stuff like that, as long as you don't have no arthritis and bursitis.
Right.
You know, you can control muscle movement, but your brain tells your muscles what to do. So it can't be a mental thing. It's not mental, implies that you can focus on it and think about it and change it. And that's just not true. There is a pathophysiology behind it. So I don't like the term mental illness or mental health.
Okay.
That's one thing. Another thing is that studies show that if a person has one physical condition, whether it be hypertension, which is pressure, diabetes, which is sugar, hyperlipidemia, fats, you know, obesity. So if you have one physical condition, you are 2 times more likely to have a mental disorder. And if you have 5 or more physical conditions, you're 7 times more likely to have a mental disorder. Why your face all torn up?
Because I'm just thinking, you know, I was looking over some things and when talking about the 5 or more physical conditions, and you're 7 times likely to have a mental disorder. I mean, 7 times likely is a big number. And I was just looking at this list.
Right. Well, I'm just,
I have some things on this list.
Oh, I mean, first of all,
Just
it doesn't. You're 7 times more likely, but it doesn't mean that you're going to have something. That's number one. Number two, somebody said 5 things. That's a lot. Like, nobody got 5 things, but it is very easy. Take diabetes, for instance. Diabetes is a disease that causes other problems. So when you're diabetic, you also, a lot of people are diabetic and they have high blood pressure. And they're diabetic, they have high blood pressure, and then they have inflammation. So they're diabetic, they have high blood pressure, they have inflammation, and a lot of times because of what they eat, they have GERD, which is like the reflux. And then so they're diabetic, they have high blood pressure, they have GERD, and then they have neuropathy. You know, so it's very easy for someone to have 5 or more conditions going on.
Yeah, we got it bad.
Well, and we do. And then when people are not physically well, or when you have to take medication every day or something like that,
it affects your mental health.
Exactly.
Yeah.
Exactly. Because that's what you're thinking about most.
Yeah.
So what causes mental illness? First, we said it's physiological. So there are physical things going on. But certainly a family history of those same physical things going wrong in your brain. You know, a family history is a big cause of mental illness. Persistent chronic pain. Not people that just want to get high on painkillers.
Yes.
But people who, because most people who have persistent chronic pain, even if they're prescribed pain medication, they don't get 100% relief.
Oh, no, they don't. Not at all.
They don't. And people don't understand that. People be like,
they don't.
They
think that it's in their mind that they have physical chronic pain. And what, and I will say pisses me off. Because you know that my mother deals with chronic pain.
Right.
And it really pisses me off that some people think that, oh, she's okay. Oh, it's all in her mind. A, no, it's not in her mind. B, you don't know what she goes through on a daily basis. But it's like she always says, everyone gets a turn. So then when you get that turn to come around with your physical chronic pain, and you can't take a perk or whatever to make you feel better, then you know what someone else is dealing with. Everyone who has chronic pain or who says that they have chronic pain is not lying. And it's not just in their mind. And I just had to throw that in as a sidebar because that just...
No, but it's absolutely true because, and we're going to get into other things, but remember when I had that procedure and I had to stay in the hospital longer, you know, than expected because they couldn't control my pain.
Right.
And when I tell you this pain, and thank goodness it wasn't chronic because, you know, it did subside after a while, a few days. But when I tell you that this pain was, and I didn't care what was going on, I didn't care who was in the room, I didn't care. All I cared, like, you have to stop this.
Yes.
This is crazy. And
Right.
I felt crazy.
Yeah.
You know what I mean? I felt crazy because, like, it was nothing I could do to control it. So that's a cause of mental illness. Sleep disturbance. Sleep is very important.
It's a big one.
Yes. People who, and you notice, people who are sleep deprived, they're snippy, you know, they're mean, and it causes you, and it causes you to behave certain ways because your body needs rest. So sleep disturbance, weight alterations up or down.
Right, and sleep is definitely a cause of that too. People don't realize how much sleep plays a part in your life. It really does. It helps you lose weight. It helps you with stress. It helps you just with a lot of things. But continue.
It does, and it's important, and also trauma. You know, those are all common causes of mental illness. And I also just want to touch on another thing, delirium, because delirium, that's where I was when I was in the hospital after I had my little procedure. I was really I really was delirious. Like I couldn't comprehend anything. They said I was screaming. I think Deja was scared a little bit because, but delirium is a matter of life and death. And a person, and I have witnessed this as, Joe Citizen or Josephina Citizen, and also as a nurse, because any life-threatening condition can cause delirium. Usually delirium comes before shock, or, when we look at things, especially like when I'm working in the ER, change in mental status. Yeah. People just don't, their mental status just doesn't change for no reason. Right. You know what I mean? It doesn't. And I remember once, and we had a patient, and this is why I love working with Dr. Lightfoot. But we had a patient, and we worked hard on her, trying to get her to be, to comply with her treatment and to be adherent and things like that. She liked to take sips of the sippy sips, Right. She liked the little sippy sips. So, and everybody knew her, where she lived and everything, whatever. So she came in for an appointment. We were glad to see her and everything, She got her labs done. Her labs came back, maybe it took 2 days for her labs to come back. And we went to work, and Dr. Lightfoot was like, go get her. Because her ammonia levels were so elevated that she knew that if she was home, she probably wasn't acting normal. And she lived alone. And when we went down there, her house is always intact and everything, whatever. Her house was a mess. And she was walking around her complex, pushing a shopping cart, talking to herself and everything. Wow. And everybody just thought she was drunk. Wow. Everybody just thought she was drunk. And, we went down there, me and another coworker, whatever, and we had to convince her to go to the hospital, whatever. But, so delirium, a lot of people, they act like, oh, that's just her. She's crazy. Yeah. Things like that. But you never know what's going on, in a person. So physical things can also cause changes in mental status, delirium, and things like that. So that's just, for me, it's important that you can't judge people all the time.
No, you can't. People need to understand that mental illness is a physical condition. It affects people's moods, thoughts, behavior, and judgment, which you just talked about.
Exactly.
And a big thing for me is we have to unlearn myths. Myths are all around us, and we really have to unlearn them. One big myth is that mental ill people are violent.
Right. Which is not, that is a big myth. And you know what else irks me about that one? Is that even healthcare professionals believe that.
Wow.
Like, only people who work in mental health are comfortable, or, consider themselves, not only, but most, consider themselves comfortable around mentally ill people. Like, I work in the ER. When people come in crisis,
oh yeah,
they were like, oh, you let such and such do that. You know what I mean? So even healthcare professionals believe that. They're always, oh, I'm scared.
And why did you even get into the field if you are scared? Because you know that certain things do come along with that. Just like you touched on, when people experience delirium, and like you said, some people have to be pushed. You don't just start getting violent if you think that is something out of nowhere. People aren't just innately violent, and so we have to get out of that. Also, we have to get out of the thing that mental illness is a choice. People need to get over that. Goodness. Mental illness is not a choice. Mental illnesses are diseases of the brain, as well as documented dysfunctions. And if you had a choice to be anything, would you choose to be that? It's just like when you have people, and we won't I won't touch too much on this, but it's just like, because it's a whole nother issue, but it's just like when people say, oh, you have a choice then to be homosexual. If people had a choice to get, treated in the way that they get treated, would they choose to do that? You have a choice, like we don't have a choice but to be black. We ain't have a choice to be in slavery, like Kanye said. So mental illness is not a choice. It's not a choice. So we definitely have to get over that.
That is true. And people need to stop thinking, they do the, he know what he doing. She, they just trying to get a check. Or all kinds of rude, ignorant things that people say, about people who are, have something going on in their brain. Yeah.
And we also have to get out of the myth that people with mental illnesses are capable of making rational decisions. Mental illness disables people to different degrees at different times. So somebody that's suffering from a mental illness can make a rational decision.
Sometimes. And then sometimes they're not able to. Right. A lot of times, I get excited when I talk science, but this stuff is all about the neurotransmitters and stuff in your brain, the dopamine, serotonin, and all that kind of stuff. And all of those things have to balance. Yeah. All the time. So if they're balancing a little better, you feel a little better, you can act a little better. If they're not balanced, then you're having issues. And so sometimes, and that's what they say, well, they know better, they can do this, they're just acting, they want to get a check. That is not always the case.
Not at all. It is, and not, more times than not, it's the judgment that people are giving people that they don't deserve. And more times than not, people are experiencing what you think that they are not experiencing, But that's about stigma, and we'll talk about that. But,
right. Well, yeah. So
I'm sorry I cut you off.
No, it's fine, because I think people want too much from people. People want too much from people. They want them to understand. They want to understand me, understand what's going on, do this, do that, whatever. And a lot of people, whether they claim to have any kind of mental illness or not, are just not capable of balancing everything that's going on in my world and your world at the same time. Anyway, so yeah. So let's talk about therapy.
Okay. Well, let's talk about it, because that conversation that I had with my doctor, it prompted her to tell me that I needed to go back to therapy. So, I used to go to therapy, and then I stopped going for a number of reasons. It wasn't because I didn't think that therapy was helping me, because I did think that she was helping me a great deal, but it got expensive. It's always an excuse of what you can find not to do something. But it's so important. I think it's important, just like how people go to counseling for a marriage, right? You need someone who is not biased, not your friends, someone who can give you a raw, clear cut look at what you have going on. And therapy does that for people. Well, did it for me.
I agree. But I think that, depending on the issue, first of all, it is important to know that in America, we do a poor job treating mental illness.
Oh, we do.
Period. We do a piss poor job. Mental health care only exists in silos. It's like mental health over here,
right? And
then health care is all the way east of that. So, and you just mentioned it. I can't afford it. So you can have Medicaid that'll pay for a tummy tuck, bypass surgery, brain surgery, but the same Medicaid won't pay for you to see a counselor because you're not able to cope, which is crazy to me. But we're trained to think that they're separate, and they're not. That's why one of the things that I do like about my job is that we touch on and do screenings at every medical appointment for mental health things.
Oh.
How are you feeling today?
Right.
You know what? In the last week, has there ever been a time you was like, you know what? I'm just ready to throw this towel in. Or, things like that. So and some people,
now let me ask you something. I don't
Mm-hmm.
mean to cut you off, but do you guys do that based off of the sickness that you are treating? Because
Probably.
you are an HIV nurse or an infectious disease nurse, so you deal with a lot of different things. But let's just keep it on the scale of on the HIV. When you treat people with HIV, we are taught that in testing and counseling, how you have people that are homicidal, suicidal, etc.
Right.
And so I'm just wondering, do you guys do the mental health check based off of that, or is it something do you think that they would do regardless?
Well, first of all, there is, and New Jersey has plenty of times led the way on a lot of programs and treatments. So we do have a specific program now integrating behavioral health and care with HIV patients. However, behavioral health as a whole, with the whole opioid epidemic, because little Susie Sunshine's daughter is now hooked on drugs and she's not afraid to say anything, and they didn't pour all this money into opioid addiction. Anyway,
Don't even get me started on that.
Child, I can't even go there. So, because of that, there's a big push in all primary care. But just like HIV counseling and testing, we say it should be done in each pregnancy. It should be done with each emergency room visit, things like that. It's going to take a long time to catch on. But it's something that I'm glad that we do. And sometimes it just tells the patient that, okay, we're thinking about you too.
Right, exactly.
And that's how they feel. Exactly. So, and we do offer some things. So we have mental health counselors, and that's for people who don't need medication. Because your first attempt should not always be medication. And sometimes people just need to talk it out.
Exactly.
They just need to talk it out. So we have mental health counselors, and then we also have psychiatrists. And psychiatrists are more for people who need medication. Their anxiety is so bad, they really can't calm down without medication. Their depression is so bad, they can't get up and function every day. Or they're, schizophrenic, bipolar, things like that, manic, all, those other kind of conditions that require medication. So, we do have those options, and I think it's good, but the way we treat it, because the mental health, because it's a brain disorder, it tricks you, because when you take your medication, it takes a while to kick in. And then it does, because sometimes some medications take about 4 weeks to get you
to get
together.
your
You got to play with doses and things like that, right? So you take your medication, starts to kick in, you're feeling a little better, you feel better for a month, 2 months, 3 months, and a lot of times people think, oh, I'm better. and then they stop taking the medication.
Mm-hmm. Then you're right
and then
back
the
to
cycle
where you started.
Exactly.
Mm-hmm.
Exactly. And a lot of times they spiral before they realize what they do. And so even though they may get back into care, some tragic things could have happened in the meantime, but it doesn't happen. So they take medication, they're getting better, they get better, they stop, they spiral, and then they get back on track and be on track forever. No, it happens over
and over again.
Right. But it still is not for anybody to judge.
No, not at all.
You know what I mean? Because if it's not for God's grace, there go I.
Mm-hmm.
You know what I mean? So that was, that's just pretty much how we, I like the fact that we incorporate mental health in our practice. And in New Jersey and HIV care, we do that. Mm-hmm. Another thing is we talk about this all the time because this is us. Check on your strong friend.
Seriously. That is a huge thing. And we talked about reading articles about mental health. You sent me something the other day, and it was funny that you sent that to me or that you tagged me on Facebook about checking on your strong friends, because I just read something. It was a headline on Twitter, and then it prompted me to click the link, and it took me to an article about just that, checking on your strong friend. And everything in the article, I was like, man, this is me. The person that's always there for people, the person that's always cleaning up the mess, and no one says to that person, hey, are you okay? It's like that person is fine. They don't have any problems because they're fixing yours. And that is definitely us.
It is. It is. And even for healthcare professionals, like I said before, a lot of them fear violence from people with mental health issues. But this is, if there's anybody out here listening that's in nursing school and you're going to take the NCLEX, write this down because this is on the test. This is free. You can thank me later. So if you're a healthcare professional, if you're a healthcare professional and you feel like behavioral health isn't your thing, you really don't want to get involved. First of all, I just want you to know that everybody plays a part. If you work in healthcare, you work in healthcare. So you have to flow with whatever comes. But what is important to know is, as a professional, everyone has a responsibility to help the patient focus on coping.
Yes.
You're not a mental health counselor. You're not a psychiatrist. We know that. That's fine. But we don't need you diagnosing, saying you should take this. Oh, calm down. Stop it. Whatever. Just help the person focus on coping. And so just coping through that moment. Right. Not through the whole whatever's going to happen 10 years down the line and all of that. Just cope through what's going on at that moment. And on the NCLEX in mental health, there's always the question. Now, they may word it a whole lot of different ways or whatever, but what would you do if the schizophrenic patient, says, stop it, no, the train is coming, whatever. The answer is always reorient to reality. That's on the NCLEX. That's free.
That's free.
That is on the NCLEX. So when you start seeing that little question like that, whatever, just, look at the answers, look for reorient to reality, because that's what you do. I know that you hear the train. I know you think you hear the train. I know you think you see the train, but I don't see the train because there's no train here. There. I know that must be scary for you, but there is no train. And, you don't do like, ain't no train. What I mean? No. But you have to just reorient them to what the reality is. And a lot of times that helps them de-escalate. And that's on the NCLEX. And
I think people can use that in their everyday life as well, not just on the NCLEX, because you come across people who could be suffering from mental illness all the time, and you just don't even know.
Don't know it.
So,
exactly.
That's just something, a tip that you can use in your everyday life. And if you're taking the NCLEX, hey, it's important. So,
It is.
so let's talk about the fact that mental illness is treatable. I mean, I think that is huge to point out. Mental illness is treatable. There is help out there, and you can get it. And one of those things BIbbi talked about was through medication. Now, some people need it, and some people do not need it. Do not need medication.
Right.
And
I think
go ahead.
And I think the biggest thing is with the medication is that you have the patient like, I don't want that. Mm-hmm. So other people put a stigma on it, and then we as patients put a stigma on it ourselves. Mm-hmm. And they were like, oh, if I'm taking meds, and they really going to think I'm crazy, or things like that. And so we really have to get past that. I don't want it, because some things like depression and anxiety, medication doesn't have to be forever.
No, not at all. I know even for me, a long time ago when I lost my grandparents, and I lost my grandparents 4 months apart. And my grandparents were like mom and dad, so it was really like losing your mother and your father and your grandparents 4 months apart. Right. And then they both died on holidays. My grandfather died on Christmas Eve, and we buried him on New Year's Eve. And then my grandmother died on Mother's Day. And so those holidays are very hard for the family. And during that time, I fell into a deep depression. I flunked out of college. I had to, do all of this stuff to get reinstated into college, writing letters. And the only thing that helped me was that my GPA didn't fall past a certain level, because I was still smart, but I just had lost all focus. And my grandparents, in my mind, my grandmother, because you know how she was, her saying like, you better get your shit together and get back in school. That's what prompted me to get back in school. But for a long time, I didn't know how to cope, and I had to get on medication. And it started out as a small dose of something, just to kind of get me up and get me through. And it lasted, being on the medication, for about 4 months. But I will say that it did help me. And I also say it's not for everybody. I didn't have side effects from the medication. It didn't make me feel bad. And sometimes when you have a higher dose of something, you can experience side effects. That wasn't my story. So I do say, get on something if you need to get on something. If you feel a need to, don't fight that.
Yeah, and I also learned some years ago that, because a lot of times people think because you're a nurse that you know everything or whatever, and most nurses do think they know everything. But a lot of nurses do think they do know everything, which irks me. But, I'm not one of those people. But I learned some years ago, I was describing somebody that, a person that I knew. And my colleague was like, oh, BIbbi, he's depressed. Mm-hmm. And I was like, what? And that was when I was still in a school of thought, like, nobody got time for that.
I got time for that, right.
You know what I mean? The depression, that's a luxury for the rich.
Mm-hmm.
Like, are you kidding me? They were like, no, depression is real. And I was like, what? And she had me read this article, and I was like, oh, my mercy. Like, this is like him. Mm-hmm. And I was like, wow. So, I called him, and so I was like, have you been to the doctor? Whatever. Yeah. And, he wanted to go, but he kind of didn't want to go at the time or whatever. And maybe 2 years after that, he still hadn't gone to the doctor or got any treatment. I brought it up because it was another seminar we were learning about depression among men. Mm-hmm. And I was sharing with the facilitator that, I just recently learned as someone that's very close to me. And I was telling him what was happening, what he was doing and things like that. And he was like, oh, BIbbi, he is not going to be able to shake this himself. Mm. He's already so far gone that his levels, will probably not straighten out without some help. Mm-hmm. And he said, does he smoke? Does he do anything to self-medicate? And I was like, not that I know of. And at the time he wasn't, but now he drinks. Mm-hmm. And he is still, and this is like, this happened about 2005. And he's still in, a bad way.
Well,
still depressed, like stuck in the state.
My mother talks about this all the time. That's a wise woman. But anyway, she talks about this all the time. Like, it's so easy to get into a depression, and it's so hard to fight to get out of it, and it really is something that you have. Mental illness is really something that you have to work at every single day of every minute of every single day. You really have to work at trying to help yourself. You do. I just, I know that I don't want to say suffer from, because I just don't like how the word sounds, but I have seasonal affective disorder, and my mom died around Thanksgiving time, and if I'm not careful, if I'm not very, very mindful of it, I will sink. And and every year it happens, and I think that's why I probably enjoy summer so much, because as soon as summer's gone and I get the first little wind of fall, it's like, oh yeah, and it happens all the time. And if I'm not aware, if I don't make myself aware, like, BIbbi, don't let it happen, like, literally remind myself, I'll sink deep. But if I keep my awareness, I'll think about, how she would want me to be living, and not pretty much be sad about it. So, so you have to do what you have to do to protect yourself. But first you have to be aware. Yep. If you want to protect yourself, you have to be aware. So self-care. Self-care is so important. If we take away nothing from this conversation, self-care is the most important thing. I mean, we can start by doing things like physical self-care, exercise, dealing with your nutrition, your water intake, your sleep, as we talked about. We talked about medication. You can do things like yoga to help you, things like that. Things that you do just for you, especially if you are, like we talked about earlier, one of those strong friends or one of those strong people. Identifying that you need to take care of yourself in being strong for other people, to be strong for yourself is very important. So, I've taken the steps to do, I talk about it all the time, even though I hate it. I talk about the fact that I'm exercising, and you all know how I feel about exercising. It's the devil. But I will say, in the time that I'm exercising, I don't think about my other problems. I'm not thinking about the stress. All I'm thinking about is, if I don't hurry up and do these fucking 30 burpees so I can get the hell out of here, that's what I'm thinking about. But it takes my mind off of all of the other issues that I deal with on a regular basis, even if it's only for that hour. So things that you could do like that physical for yourself is very important.
Yes, and also lifestyle habits are important. Everybody want to be out here living their best life, and a lot of the stress comes from people trying to keep up with the Joneses and think, doing things that they think that they should be doing based on what other people are doing and things like that. But the truth is, it is true. The truth is that having structure and a routine is one of the things that really people who live mentally, physically healthy lives have structure and routine. And a lot of this I learned from Jiggy. Because, with him having autism, he is, because, I am a true Sagittarian. I'm just a fly by the seat of my pants kind of person, which causes, which gives opportunity for a lot of chaos to happen. And I'm okay. I don't get bored, thwarting chaos. Right. But Jiggy is like, I don't live like this.
Right. Right. I need it to be like this. And that's it. Right.
So autism rules the house, but you will find that when people are less stressed, when they have a routine, they have a structure. Now, not to the point where it's OCD, that if any little thing is off, then you can't cope. But having structure and a routine is good. Also, spending time in nature. Now, I ain't no camper.
Me either.
You know what I mean? I'm not a camper, but I do appreciate nature. I do take I don't take the highway to work. I take a different route because every day I like to ride through the park.
Okay.
So coming and going, I'm always riding through the park. I see people jogging. I'm like, I need to be out there.
Yeah.
You know, I see.
That's what I would be thinking too. Look at them.
Oh, look at her. You know what? And there's this one guy. He's like 9,700. And I just be like, you know what, BIbbi, you are trifling because there is really no.
He out there
what kind
doing
of
all
excuse?
that. Look at you.
Yes, and he
Driving
is trying
by
too.
him like, look at you, hey.
And I mean, he's probably trotting just as fast as I would be.
Exactly.
And he like 9,700.
I'm more into the fast walk than the trot. It's a lot of times.
No, he is
trot,
trying.
I know what you mean.
He is raising his heart level. You hear me? He is really trying. Like, oh my good. And his outfits be matching. And like when you look at people like that, you really have no excuse.
Right.
It's really terrible. But anyway, you know, but you look at things like that. I watch the fall foliage come down. Mm-hmm. You know, I see the people with their nice dogs. I'm like, oh, that's a nice looking dog. You know, stuff like that. It just makes you appreciate. So I think nature is like one of those lifestyle habits that help you with self-care. Setting goals are so important. It is, and I don't care how big or small the goal is. A friend once told me when I was in one of my funks, he said, and I hung it up on my wall, he said that small victories increase confidence and countenance. Like, it doesn't matter what, you set a little goal, it's a small victory, and it increases your confidence and your countenance. It just makes you feel better about yourself. So set goals. You know, some people I'm funny. I like to laugh important things off a lot.
Well, you know
I think is right. And first of all, I said I'm funny. I don't think I'm funny, but other people
be
laugh
cracking
all
up
the time. Like they think I'm funny. I don't know. Pleasurable activities. I ain't got too much of that going on. Relaxation. I have started to relax on Sundays. I don't do anything on Sundays, and that's really been good. But those are things like, these are self-help things that you can do. Lifestyle habits. You know, structure and routine, good time management, spending time in nature, doing fulfilling work. We talk about volunteerism on a podcast. Setting goals, relaxing, pleasurable activities, humor, music therapy. Yeah, I'm not really into that, but you know, you could be. Or creative, some kind of creative self-expression. Time for beauty. Now, I do that. I be on YouTube University trying to get that smoky eye going on. I be looking like two raccoons, like, oh.
And even like time for beauty, just like people always say, you know, we talked about this when we talked about saving our first $1,000, like not going to go get your nails done, not going to go get your hair done, you know, so that you could save money. And I talked about it then. Stuff like that, I can't cut out. And the reason is not because I want to just go get my nails done or I just want to go get my hair done. But time at the hairdresser is time to not do anything. It's a time to relax. It's a time to focus on just me. You know, getting your hair washed, talking crap to the people in the salon, you know, coming out looking beautiful. It makes you feel better. You know, which doing better, feeling better, looking better affects your mental health. Totally. And setting goals, when you talked about that, is so big. My trainer talks about that all the time. And when you were talking about it, just made me think. One of my goals that I always talk about is not eating in my bedroom. Like, my mom says, you couldn't wait to get a couch. Like, soon as I moved, I was like, I gotta get a couch. And she was like, why? It's only you. You know, you got a bed. And I was like, no, I need a couch. Like, where am I sit on? I could count the number of times that I sit on my couch. Like, I just like to be in my room. I like to do everything in my room. And one of the goals that I set for myself was to not eat in my room. So now I can't
even believe that you eat in your room.
Me either.
Being raised by Sophie.
Huh?
Was you allowed to eat in your room young?
No. And it's crazy that I even eat in my room now because you know how I am and how I keep my house. So it's funny that I eat in my room now, but I do. I just like to be in there. But anyway, the goal that I set was to eat at my table, which I couldn't wait to get either. And so now I started eating at my table. And it really has helped me a lot. You know what? It helps me not eat as much because I'm like, I gotta hurry up and eat this food so I can go back in my room. You know? It helps me tremendously. But I mean, just when you talked about setting a goal, that was a small goal, a small victory that I'm continuing to, have. And it is creating a lot of confidence.
It really does help.
Mm-hmm. So, go ahead. I'm sorry. I don't mean to cut you off.
No, you could go. Go ahead. I was going to say another one, but go ahead.
Oh, no. I just wanted to talk about self-care for like social support,
Yes,
social support is very important, leaning on your family, your friends, like we talked about therapy, building a relationship with your therapist, a minister, you go in and go see a minister, talking to a rabbi, support groups even. Support groups are huge. I used to be in charge of support groups when BIbbi said she worked for
she
me
was my boss.
when I was her boss. I wasn't her boss, but in any event,
yes,
I dealt with support groups and I just saw the tremendous help that it gave people. I know a lot of people in recovery, and what that support does for people and for their mental and their physical health. Day treatments like going to the spa and things of that nature, that helps you. Even like BIbbi said, seeing people with dogs and pets and animals, those kind of things help you. And we talk about volunteer work a lot on this podcast. Volunteer work, just being around other people, helping someone else in need, that could give you a fulfillment and really help your self-care when we talk about your mental health.
Right. And another very, very important part of self-care is your spirituality. Mm-hmm. Because regardless of your religious beliefs or lack thereof, human beings are spiritual people.
Right.
So you don't have to be a Christian per se, but when you live life and you have a longing, old people say you got an itch you can't scratch or something. You have a longing for something. That's the spiritual part of you looking to connect with, your spiritual higher power. Mm-hmm. So, I cannot, now I'm a Christian myself. Mm-hmm. I'm God's favorite. Everybody knows that. So I pray, I talk to God and he talks to me. I just, we just be having conversations,
right?
So prayer is my way, but meditation, practicing mindfulness, which mindfulness is a big thing now, there's a whole big thing. Y'all can go on YouTube University, look it up, but prayer, meditation, mindfulness, a spiritual community. Some people even think like yoga is also spiritual. Forgiveness. No matter what you believe, forgiveness is a spiritual thing going on in the body. And also, usually like 12-step programs, they kind of have a spiritual structure. And again, it's not about what you believe or what your religion that you practice. These are about spiritual things, and spiritual things really do help with self-help. Self-care really is a part of self-care. So these are all things you can do if you find yourself in a funk, or if somebody that you care about, you're noticing that, oh my goodness, you done came to work 2 days in a row and your clothes is wrinkled. Or, oh, you haven't been to the last 4 events when we all got together. Or, something's happened. A lot of people are there as soon as the death happens and they attend the funeral. But what about 30, 60, 90 days after that? Are you still checking on people?
Right.
So these are things that you can use for yourself and also for, someone that you care about. We need to encourage each other to take care of our mental health. Even though I hate that term. That's what I'm going to do. I'm going to come up with another term.
Well, when you come up with it, then you let me know. And
exactly.
Then we'll see about using another term. But last but not least, in self-care, and what's important in self-care is mental and emotional self-care. Thinking like an optimist.
Oh my goodness. I am so optimistic. And I cannot stand pessimists.
I will say that I am a pessimist in certain things. Now, when we talk about things like me and you talked earlier, and you were like, when you say, hey, I'm gonna open up a store, and then somebody says, well, what about this or what about that? I'm not a pessimist in that way. And I think that even a person that does that, they could be just getting you to look at the bigger picture that you're not looking at. And it's a way that you can present that. Now, if a person is just like negative, I think that I'm a pessimist in certain things just because it's not like I can't see the good, but I probably focus on the bad more than I focus on the good.
The what if.
Yeah.
The what if. And I just feel like, what if, first of all, you can't think of all the what ifs.
No, you can't.
So why are you what ifing the ones you can think of? Leave me alone. I don't have time for that. Yeah.
Well, I'm not going to shit on your dream. If you have a dream and you tell me about it, I'm not going to shit on it. But if somebody tells me something, I will maybe not even say it to you, but I will what if it to myself. I don't know, girl. What about if she go down there and then that don't work? And what about if she... Yeah, I will do that to myself, even if I don't do it with you. But thinking like an optimist is important when we talk about mental health. You always want to think positive when you're thinking about mental health and self-care concerning your mental health. Working through grief is a huge thing. Grief affects so many people. We all have a number, and that number is going to come up with all of us. None of us know the time, nor the day, nor anything. And so working through losing someone, losing something, is truly important for your self-care. Grief can really bog you down. It could really take you under, and it could take you out.
Right.
It really can. Mm-hmm. It really can.
I know people who have lost their mind behind other people losing their mind and losing that person. Mm-hmm. And it really did take them out. Yeah, people do die from grief.
Yeah, and grief, and remember that grief is not always a loss of someone dying. You can grieve a relationship. You have a husband and a wife, and they get divorced. You could go through a moment of grief with that. You can grieve. No, I'm just saying it happens.
I'm just joking.
You think about spending half your damn life with somebody. I've been with you 30 years, and then we get divorced. If I've been with you 30 years, we're not getting a divorce.
We're not getting divorced.
Point blank, period. I better be with you 30 minutes for us to get a divorce. But that's neither here nor there. That's another topic. But I'm just saying, grief comes in all forms. So you can grieve other things other than someone dying. So working through that is a big thing. Overcoming the stigma of depression. Know that if you are experiencing depression, if you are depressed, there is hope, and you can get out of that. And you don't let anyone make you feel bad about what you are experiencing, Mm-hmm. And for those of us, not me, but just those people who judge people because they are experiencing depression, you need to get out of that too. You never know someone else's story. And so overcoming the stigma of depression is a big thing. And the last thing is practicing daily affirmations.
Oh, yeah.
Yeah, I mean,
I have affirmations.
I never really thought that affirmations really made a difference in life until I started going through things in life. And then I started saying affirmations to myself, posting them up on my mirror, a la being Mary Jane, and just looking at them every day. I have a thing on my door that says to do. It's a to-do list. It's one thing. It says to do. And then it says, what? Be happy. Be happy.
That's
Just
right.
like be happy. Because I'm telling you, there's so many things that can steal your joy. But those are just some things that we wanted to touch on as far as self-care when dealing with mental health is concerned.
Right.
Did you?
And I just always want to end on a positive note. And I just want to say that if you or someone you know is in a bad way, now I don't care if they have been diagnosed with a mental illness before, or, if it's something like depression, or they feel they need meds, or they feel they don't need meds, or whatever. If you decided to go to therapy, whatever. There are people out here that will support you and your decisions for care. And I think it's very brave of people to say, you know what, I have an issue. I'm going to work on this issue. I want to live my true best life. There are some obstacles to some barriers to care, some issues with access to care. But maybe we'll post some sites on our Twitter page or our Facebook page or something. But certainly, you can email us with something, and, we can help you find what you need where you live.
Yes, I agree. And nothing wraps up the podcast quite like what BIbbi just said. We hope that you got something out of the podcast today. We hope that if you are experiencing anything with mental health, as BIbbi said, that you do seek care. Remember that self-care is important. Remember that mental illness is physical,
Right.
And it's something that affects the brain. And it's not just something that people are just going through just because, And so, we want to say that you can always send us an email, as BIbbi said. You can send us a confidential email if you need avenues to go for care, or if you just want to tell us something that you may be experiencing and we can help. We are not counselors, but we can, support you through anything that you're going through. And remember that you can always send that to wedidthatshit@gmail.com. Again, it's one word, wedidthatshit@gmail.com. Remember, you can always follow us on social media, send us a DM or anything that you need. We can be found on all social media sites, Facebook, Instagram, and Twitter @WeDidThatShit. Again, it's one word, We Did That Shit. Remember, you can always follow me on my personal Twitter. It's MyMy13. That's MYMY13.
And I'm at BIbbi Amina. That's BIbbiAmina.
Yeah, so we'll be here again the same time next week. Remember that all new episode drops every Monday, and you can find us anywhere where you can listen to your favorite podcast. That's Spotify, iTunes, Google Podcasts, Stitcher, Castbox. We're everywhere. So anywhere that you can listen to a podcast, you can surely find We Did That Shit. We'll be here same time next week.
Remember, be happy. Do that shit. I love you, Maya.
Love you too.